Hello, my name is Kyra Knighton,
And I'm Shatina Ivy.
and we're here to talk to you guys about promoting healthy skin and feet in the elderly. So, starting off with the introduction, the skin is the largest organ of the body, and it's often overlooked by nursing because we're always busy dealing with their um, acute and chronic conditions. And it's important to preserve their skin integrity and feet because this function is vital to their well-being. Okay, so advancement in treatment in acute and chronic conditions has allowed people to live longer. So this picture here, it has an elderly woman doing gymnastics. I like that picture. This population is known to be in nursing homes and what do you call it? Nursing homes and skilled nursing facilities. So they're constantly getting their medications on time and being cared for, which allows them to live longer. It's inevitable deterioration to the body systems and organs because the skin is the organ most exposed to physical influence. So the longer they're living, the more their skin is being exposed to all these external factors, such as heat, cold, friction, pressure. These sorts of things have wear and tear on the skin. Okay, so health concerns and trends. The most common skin problems seen in this age group is cirrhosis, pruritus, herpes zoster, which is shingles, and cancer. This population is also at risk for fungal infections and pressure ulcers due to impaired mobility and being medically fragile. Excuse me. Okay, so I posted some pictures up here of the different conditions. So the first one is cirrhosis, and it's just extremely dry, cracked, and itchy skin. The second one is shingles. It's a viral infection that's frequently seen in older adults. And the third is cancer of the skin, and this is the most common of all cancers. Just a continuation. Diabetic foot ulcers. It's sores of the foot that are known to be complications due to diabetes. Fungal infections. It's common in this age group, and incidences increase as they age. The last picture is a pressure ulcer. That's actually stage 2, and this is an injury to the skin resulting from pressure or in combination with shear, usually over a bony prominence.
All right, next up, we're going to talk about nursing interventions as it pertains to skin care, and then we'll overview the foot care aspect. Okay. The most important thing to remember is that nurses should strive to maintain skin integrity as it pertains to any environmental, mechanical, or chemical factors that can lead to the breakdown of the skin. The main goal is to maintain skin integrity, and that's very important in the aging process. Prevention is key because prevention will in turn help in cutting out any other issues in the long run. Some of the preventive efforts include reduction of friction and irritation to the skin, reduction of moisture, and this can be done by making sure that the fat folds have been dried. Displacement of body weight just includes making sure you develop a turning schedule for your patients. Most oftentimes, it's every 2 hours. Documentation helps with that process to keep everyone accountable as well. It's also important to know that when you are doing the dressing change, it's good to follow orders that the doctor has prescribed instead of following what you see. Sometimes nurses follow what has the previous wound care, and it may not be the best wound care for the patient or the prescribed wound care. So it's good to just follow up with the orders when you're changing your wound dressing. And also, sometimes it's just good to keep the regimen simple. It's been noted that lengthy wound changes or lengthy procedures aren't as good as sometimes just keeping it simple when it comes to wound dressings. Another factor is nutrition. It's important to monitor the caloric intake, making sure the patient who has the wound, especially the elderly, are getting enough nutrients and calories. You want to monitor lab values. Some of those would be the hematocrit, albumin, and the hemoglobin level. You also want to make sure the diet has enough of the fatty acids, proteins, which is good for healing, and vitamins to help continue in the healing process. Education is key because you want to make sure the patient is not only just aware of what they need to do, but also you need to empower them so that when they go home, they can continue with their dressing changes. Some nursing interventions for foot care. As a nurse, we must remember that, for instance, in long-term care facilities, we're oftentimes the primary people responsible for ensuring proper foot care. It's important for maintaining mobility, which is important for the elderly community, as many of them want to continue the independence that they had prior to the aging process. The main goal for foot care is optimal comfort and function. And again, with the focus being on education, we want to reinforce the importance of proper footwear and also proper care for toenails, making sure you're cutting straight across. If you're filing, it's not good to round out the edges, but just make sure that the toenails don't get caught on stockings or things of that nature. Let's see. And you want to make sure that you have a proper shoe fitting. We know that one foot is larger than the other foot, so it's important to make sure that you fit the shoe for the largest foot. In teaching and learning strategies, in order to even review the type of nursing plan, especially if you're going over topical ointment nursing care plans, you want to make sure that the patient is literate, that there's not a hearing deficit, in order for them to be able to benefit from an outlined plan. We know that at least about 93 million Americans fall into the reading category of below basic and basic reading levels. So you may not want to come out and ask the patient flat out, are they able to read and write? But having a detailed discussion can kind of give you an indicator of their literacy level. Also, if you're doing the teach back plan for how to cut your toenails across, you want to make sure the patient can hear you, and will then be able to do the teach back method. Brochures need to be legible, and they also need to have a good size font in order that the older person is able to view the document. So when it comes to teaching and learning strategies, it's important to consider the population and just ensuring that the tools that you use, brochures or teach back method, are going to be able to be used by the elderly patient.
Okay, so now we're going to talk about alternative therapies. Excuse me. So the first one is moist wound healing. This care is focused on healing wounds in a moisture environment compared to the conventional way of wet to dry dressings. So dry dressings are usually changed daily with a dry gauze. With moisture dressings, it's usually changed every 3 to 5 days. This is known to decrease patients' pain and decrease their need for pain medication. Some signs to show that there is not enough moisture on the wound could be a dry wound bed, painful dressing changes, and slow healing. Signs that there's too much moisture on the wound is maceration around the peri-wound area, possible increase in wound size, and also slower healing. Excuse me. This therapy isn't great for all kinds of wounds. In specific, necrotic digits due to ischemia and neuropathy, this isn't the type of therapy that you would be using for that. This is a moisture retentive dressing, and you can use it with algae dressing or a cling film. Okay, next is honey therapy, and we just listed all of the benefits. It delivers a moist wound environment due to its viscosity. It's able to absorb exudates from the wound. It has antibacterial, fungal, and inflammatory properties, and it increases granulation of the tissue. It's also known to stimulate tissue growth, reduce edema, and to decrease pain. And these are our references, and that is the conclusion of our presentation.